In Good Health tonight, millions of people are on medications to control their blood sugar because of type 2 diabetes.
But some new guidelines are changing the targets of treatment, suggesting people may not need as much medication as before. Dr. McGeorge is here to explain exactly why.
Well, Karen and Jason, people with type 2 diabetes should be familiar with the blood test called the hemoglobin A1C level. Basically, it gauges a person's average blood sugar over the previous 2 or 3 months. Well, today, the American College of Physicians loosened the recommended A1C goal, making control easier and safer for millions.
Keeping your blood sugar under control is crucial to prevent complications of diabetes like stroke, heart disease, or kidney and nerve damage. Generally, it was felt that keeping sugars as close to normal was best, but a new evaluation of existing information shows that may not be true, particularly when A1C levels are being targeted.
Treatment with drugs targeted to 7%, in contrast to 8%, does not prevent heart attacks or strokes, but it does result in substantial harm, including low blood sugar, increased medication burden, and increased cost.
Prior recommendations were to keep A1C levels as low as 6.5% to 7%, using one or more medications when necessary. The new goal is higher, between 7 to 8%, meaning a person would need less medication and their blood sugars would be less tightly controlled.
Studies do not show benefit treating to an A1C level below 6.5, but they do show harms.
The group recommends that people with A1C levels below 6.5 should talk with their doctors about reducing or discontinuing their medication. And ideally, people with type 2 diabetes should have the goal of controlling their blood sugar with diet, exercise, and weight loss.
So I want to be clear, this only applies to people with type 2 diabetes, not type 1 diabetics on insulin. Finally, one other recommendation in the paper was to avoid targeting A1C levels in people that have a life expectancy under 10 years due to age or some other chronic conditions, because basically the harms of overtreatment outweigh the benefit. Back to you.